last speaker is Dr. Yongping Chen, come from American. Dr. Chen gave us a topic is abdominal acupuncture for pain relief. Let me briefly introduce Dr. Chen. Dr. Yongping Chen, she has got a PhD in Guangzhou University of Chinese Medicine. She was as a director of the experimental acupuncture department in Guangzhou University. Currently, Dr. Chen works in American. Since Dr. Chen learned about abdominal acupuncture from the inventor, Professor Zhi Yunbo. Is abdominal acupuncture has been widely used in Dr. Chen clinical practice for more than 10 years. Abdominal acupuncture has become her main technique for relief pain and other internal organ dysfunctions. Dr. Chen also currently serves as Secretary General of the American Association of Abdominal Acupuncture. Very brilliant, yeah, biography. So let us warmly welcome Dr. Chen for presentation. Are you ready, Dr. Chen?
Yes, Dr. Hui. Yeah, can you hear me?
Yeah, I can see you.
Can you see my presentation?
No, your PPT. Can you try again?
Yeah, I clicked the
share 共享，你看那个
Yeah, I know. I clicked the share screen.
No worry.
Ask me who can share. Only host. Okay.
Give you authorize. You have authorization.
Host. Did it come out?
No.
Okay, okay, I click.
No, PPT already on your computer?
Yeah, because there's on my
You click 共享屏幕 share your screen. Click there and then you can see your PPT.
Yeah, I always can share, no problem.
No worries, your last one.
Yesterday.
You try.
Sunny California. Today my topic is abdominal acupuncture for pain relief. Abdominal acupuncture is a unique system of acupuncture, big family. So my topic will cover what is the abdominal acupuncture, the advantage of abdominal acupuncture in pain relief, the indications and the contraindications of abdominal acupuncture, and including a case study, very interesting case study. I'm sorry I couldn't present this recording. I have patients, follow the patient, have a lot of videos, can show the patient talks very well about her symptom before, after treatment. So I will share this with Dr. Nie Hui. Then I hope everybody can see it. So what is abdominal acupuncture? Maybe some of doctors, colleagues already learned the system. So basically it is a method of treat systemic diseases by needling at specific acupoints on abdomen. So all the points on the abdomen, about 20 to 24 points are all located in the abdomen, but it can treat the whole body's conditions, including pain syndromes, and internal visceral conditions. So abdominal acupuncture is found. The Dr. Zi Yunbo from China, he is a founder of the abdominal acupuncture therapy. He found some abdominal acupoints more effective in some low back pain patients in 1972. And in 1992, he established this abdominal acupuncture system. So he has taught in China, Europe, America, and Asia. So in 2007, he came to Los Angeles, and I learned abdominal acupuncture. Ever since, I'm practicing this unique therapy. So before we learn abdominal acupuncture, we need to understand the system. So the theory is categorize the abdominal wall as 3 layers or 3 levels. And that will guide us to use the needling technique for 3 depths. The superficial level, called heaven level or Tian, it is covered dermis and the subcutaneous level. The second level is called Ren or people, medium level, that's the fascia level, superficial fascia and the fat tissue. And the third level is called earth level. That's a deep level. Actually, it's a muscular level. So the needle will go as deep as the muscle. So that is also called 8 octants system or Bagua system that connected with Zangfu. So that's the deepest level. So the superficial level is also called a holographic reflection system. The picture is called a hologram. This level reflects the image of tortoise. It's like a tortoise. It connects with the whole body anatomically, targets points for musculoskeletal pain. The median level reflects 12 standard meridian. This system will transport qi blood from Zangfu, from the deep level to holographic system to the superficial level. So it's a medium level. So before we learn we use a technique, we must understand this new view of the abdominal wall system. So next is a picture. I'm so sorry you cannot see the picture, but the picture actually you can see from internet everywhere. Looks like a turtle. Maybe I can show you here. I didn't have the color one. The color one is Can you see that?
Because due to background, yeah.
Oh, because I have background. Okay, now you can see a little bit.
Not very clear. It's okay.
Not very clear. It's okay. So I just mean you can find from internet. And the second picture is the Bagua system, 8 octants. And the third one is the abdominal acupoints. We can introduce the acupoints later if we have time, okay? So next I'm talking about the advantages of the abdominal acupuncture in pain relief. We know we have a lot of different ways to treat the pain, especially for musculoskeletal pain. But this unique system has some advantages. Number one is almost painless or very minor pain on needle insertion or manipulation. Maybe we wonder how can that happen, but we probably already have experience. When you put a needle on the tummy, the stimulation is minor than most other part of the body. And also because the abdomen does not have the inflammation, have the pain as your forelimbs or back, neck, shoulder, arm, and other area. So we are needling on the non-inflamed area. So the needling is less painful or painless. It's also safer and easier operation. Safer because we know the abdomen is deep, and also it's concentrated in the inside is the stomach, intestine. So it's not, also you have a layer. Abdominal acupuncture mostly is superficial. You don't go too deep. Okay. When you touch the muscle, that's it. The deepest level is muscle, the abdominal wall. And it's highly effective and quickly responsive. That we can see from my case report. And also extensive indications. It covers whole body anatomically. So from head to toe. So the indications of abdominal acupuncture, it covers not just the pain, actually it's covered internal medicine, the insomnia, anxiety, depressions, stroke, recovery, etc. And also gynecology, system disease. I don't introduce too detail, but it's more for pain, today's topic. So abdominal acupuncture for various pain, including musculoskeletal pain from neck, back, low back, sacrum, to shoulder, elbow, wrists, fingers, hips, knees, ankles, toes, etc. And also works for neurological pain, like a migraine, RSD, or now called CRPS. My case study is the CRPS, called complex regional pain syndrome. That's one of the most painful pain syndrome. The patient's pain is could go 13, 15 out of 10. It's really painful. So also for the inflammatory pain, like a post-operative pain, trauma, arthritis, etc. So the contraindications of abdominal acupuncture, we all need to understand. It's mostly for patients who have spontaneous bleeding, or the stomach wall has skin lesion or infection, ulcer, or tumor scar. So next will be my case study. The case is called complex regional pain syndrome, CRPS. If we understand this pain syndrome, we know it's very, very painful. Some people really suicidal. This patient, she felt the same before she came to see me. So her hand is swelling, the whole palm swell, and the finger so swell up and stiff, she cannot even hold anything. So painful. And the color of the skin turned to purple because the vein the blood vessel dilated. Her pain, she told me, was 13 to 15 out of 10. So she gave me all the video before she came to see me. So she had right before she came to see me, it was May 10, 2021. Her CRPS flared up. She self-recorded that video. And she also gave me the x-ray, showed she had 2 screws in the first metatarsal after surgery. So CRPS usually caused by surgery or some trauma. So that pain, actually her surgery went well. Her hand heals well. It's in her mind. So her mind still feels that pain connection is neurological and stress related too. So May 13, she had the first visit. After 35 minutes, abdominal acupuncture only. I don't put any needle on her arm, hand, neck. Of course, it's impossible to put a needle there. It'll be very, very, she'll scream. She will run away. She already has so much pain. So I put an abdominal acupuncture. That's why I said it's convenient for this patient. After first treatment, her swelling went down, her pain went away, and the hand is not sensitive by palpation. The purple color in the wrist also turns out lighter, and you can see the picture. She's smiling, relaxed, and feeling hopeful. So first time in, she had this problem started last October. So in almost 8 months, she had the pain. Every day or every other day, sometimes go like 2 weeks at the most. So the June 3rd, 3 weeks after first treatment, she has never flared up like a swelling, pain to 13 to 15 out of 10. She was really happy, excited. So that is the 3 weeks she had not had flared up. She has some moment, the pain, she felt pain, burning pain, but only 2.5 to 4 out of 10. Occasionally, very occasionally, she had a 10 when she really stressed out with something. So she stated 60% of the time she was pain-free. That was significant. And she had this video actually very cute because I told her I'm going to participate this conference, and she said, yeah, she's willing to contribute to help us to learn her situation improvement. And she actually mentioned this meeting. So June 29 is the last day of treatment. Before this meeting, she gave me another, I gave her another video recording. And she stated the patient is happy, calm, and she stated pain-free most of the time, only 2.5 out of 10. So more time, no pain-free. The last is the resource for learning abdominal acupuncture. So I displayed some of the book of Dr. Bo Ziyun. And Dr. Bo Ziyun, now he's practicing in Beijing, Guoyitang, Beijing University of Chinese Medicine, the Guoyitang Clinic. He also has his own Ziyun Tang as teaching facility organization. So that's my report. So I have my email. If anybody interested to, we exchange ideas, learn together, you can email me. My email address is Dr. Chen, YP, drchenyp@gmail.com. Thank you for the organizer of ATCM. Especially thank you for Dr. Nie Hui for many times contact me, and I prepared, but just I don't know what happened this system, and I'll give you all the PPT. And thank you for all the previous in front of me, all the wonderful lectures. I learned a lot from you, and together we united, we can make this medicine, acupuncture and Chinese medicine, more beneficial, more accessible to the people, to relieve people's pain and other conditions. Thank you for today.
Okay. Thank you very much, Dr. Chen, for your good speech and hardworking. So although your computer has a problem temporarily, you try to finish your speech. We're all proud of you. Thank you very much. Okay. So, hi, everyone.